Hi there, in this video, I'm going to show you some simple home remedies that you can use to abortion. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. Some people may contemplate a home abortion if they are faced with an unanticipated pregnancy. Abortion home remedies, according to online sites, are both safe and effective. Some people advocate taking a lot of different fruits, herbs, or supplements. Others advocate severe exercise or introducing tools into the uterus through the cervix to induce abortion. None of these solutions are viable. Some are just ineffective, while others may result in disability or death. The hazards of home abortions are discussed in this article, which range from toxicity to life-threatening infection. We also discuss the alternatives available to folks who want to safely discontinue a pregnancy. An unfinished abortion, an incomplete abortion, is one that was not completed completely. It happens when a pregnancy terminates but some fetal tissue remains in the body. To minimize major blood loss and the possibility of serious infection, an incomplete abortion must be treated immediately. An unfinished abortion can possibly be lethal. A person may not realize the abortion is incomplete until they have significant symptoms, such as bleeding. Toxicity. Taking herbal remedies or abortion pills obtained from shady web vendors might have dangerous effects. Even natural medicines may be hazardous, especially when used in high quantities. When humans consume dangerous levels of anything, the liver is put under strain to remove the poisons from the body. In extreme circumstances, this might cause liver damage or failure. Some websites promise to sell abortion drugs, but many of them are fake. They may be detrimental in some situations. Products from foreign nations may include heavy metal contamination. The Food and Drug Administration, FDA, and other regulatory agencies do not monitor these items, putting the public at risk. Hemorrhaging. Hemorrhage is a significant loss of blood. While all operations, including surgical abortions, include the risk of excessive bleeding, an abortion done by an untrained individual considerably increases that risk. Internal bleeding is dangerous and might go unreported until it is too late to stop it. Scarring and infection. With surgical abortions, there is a danger of infection and internal scarring, but this risk increases considerably with at-home surgical abortions. Inserting anything into the uterus through the cervix is particularly risky since it can cause infection and scarring. Both of these consequences can result in various health problems, including infertility. Severe infections are potentially fatal. Medical care in the comfort of one's own home. For people who desire to terminate their pregnancy at home, there is a safer option to home treatments. A doctor can write a prescription for a patient to take at home. This is referred to as a medical abortion. This alternative is becoming more popular in the United States. A medical abortion usually entails taking two medications, mifepristone and misoprostol, at different times. Misoprostol causes the uterus to contract and remove the uterine lining, whereas mifepristone produces hormonal changes that allow the pregnancy to stop. Medical abortion has a success rate of up to 99% when used to end an early pregnancy. According to the National Health Service, NHS, of the United Kingdom, it does not increase future pregnancy complications. Depending on local legislation, medical abortions may be available for women who are 10 to 12 weeks pregnant or less. Medical abortion is also recommended by the WHO for women who are more than 12 weeks pregnant. But these abortions should take place in a medical facility and be done by a doctor or nurse. It is important to remember that causing an abortion is against the law in many countries and in some US states. Abortion through surgery. When medical abortion is not a possibility, doctors conduct surgical abortions. During a surgical abortion, also known as dilation and curettage, DNC, a surgeon will use suction and a sharp instrument called a curette to remove the fetus. After 12 weeks of pregnancy, surgical abortions are available in many regions. Other methods for stopping the pregnancy are limited beyond this point. A doctor will usually only perform a surgical abortion if the pregnancy poses a risk to the birthing person's life or if the fetus has developmental abnormalities. People who are thinking about having an abortion should talk to their doctor or midwife about how they feel about keeping the baby. Legal surgical abortion is both safe and effective. In rare situations, a DNC can result in uterine wall scarring, known as Asherman's syndrome. Endometrial infections and other factors can also be the cause of Asherman's syndrome.